Well, we know that chemotherapy has remained an important treatment for mCRPC. It's an important treatment for mHSPC. And the CARD study that was published last year showed that cabazitaxel, for example, as third-line therapy for mCRPC remains quite important. That is, even after docetaxel and even after first-line AR-targeted therapies such as abiraterone or enzalutamide, giving more chemotherapy with cabazitaxel has a significant survival benefit compared with going back to another AR-targeted therapy, for example, Abi if you had used Enza, or Enza if you had used Abi. So I think in 2021, the real message for clinicians is that chemotherapy remains an important treatment option for mCRPC. And if a patient hasn't received chemotherapy, you really ought to consider it. Even patients who are older or have comorbidities, there are ways of making chemotherapy more tolerable. And it clearly, in study after study that it's been looked at, it clearly improves survival, progression-free survival, and other important clinical outcomes. So in patients that I take care of, I really always have a reason, I have to think of a reason not to use chemotherapy if I want to extend their survival and have the best possible outcome in terms of fighting prostate cancer.